Joining me on the phone to discuss the plague, yes, the plague, and the situation in Mexico is Dr. Paul Ettestad. Dr. Ettestad is the state public health veterinarian with the New Mexico Department of Health. Dr. Ettestad, thanks for taking the time to talk to me about the plague. How are you today, sir?
Oh, fine. Thank you. Thank you for calling.
Great. First, I'd like to start out with, because I assume that the majority of my listeners are lay people, and they may think that the plague is something out of the history books about the Middle Ages. So can you talk about what exactly is the plague?
Sure. Yeah. I mean, it is a disease from the Middle Ages, but it's also here in the western United States. So plague, it's an infectious disease of animals and people that's caused by a bacterial germ, and the scientific name of that germ is called Yersinia pestis. It can cause a severe life-threatening disease in people that, fortunately, is fairly rare. But probably about half the cases of human plague in the United States each year occur here in New Mexico.
Right. And there's a variety of symptoms. It's not all bubonic. What else can we see in humans?
Yeah, so symptoms of plague typically in people, typically the plague circulates in the environment between rodent fleas and the rodents. And so typically most people get plague from a rodent flea bite, though they can get it also from handling sick or dead animals. But typically 2 to 7 days after they've been exposed, they'll start to have a sudden onset of a high fever, muscle aches, headache, chills, and maybe extreme weakness. In about 75% of the cases, a lymph gland or lymph node in the groin area or under the arm or the neck area becomes extremely painful and tender and swollen. That's called a bubo, and that's why this form of plague is referred to as bubonic plague.
Right.
People can also get plague and have a severe infection in their bloodstream, and that's called septicemic plague. And then, of course, if it gets into their lungs and they develop a pneumonia, it's called pneumonic plague. So it's the same bacteria, it's just in different locations, so it's different clinical forms.
Sure. And this is all treatable by antibiotics.
It is. So this is a bacterial disease. So yes, if it's recognized early enough and people are put on the appropriate antibiotic, it is curable. Unfortunately, even when we have people who get on the appropriate antibiotic, unfortunately, still about 1 in 7 cases, or around 14% of cases, are fatal.
Right. And as you mentioned, flea bites are probably the major way people contract this serious infection. Is there any person-to-person transmission?
You know, that's been in the past. There hasn't been any person-to-person transmission of plague in the United States since around 1924, 1925, when there was an outbreak of plague in the Los Angeles area out in California. And I think there they had like 30 out of 32 people died, and there was person-to-person transmission. But since then, there hasn't been any here. Now, maybe other places in the world where plague has occurred in like Asia or Africa, and people don't get the appropriate treatment and they go on to develop pneumonic plague. There may be some cases of person-to-person transmission, but none here in the United States for a long time.
Right. Very good. Now let's get back to New Mexico real quickly. You've reported 3 people from your state that have contracted the plague, and fortunately, I believe I read they all recovered.
Yes.
And these are the only cases in the United States this year, as far as I know.
Correct.
So my question to you is, why New Mexico, and in a more general sense, why the western United States? How come I'm not seeing this in Florida?
Right. So if you look back at the history of plague, you know, there wasn't any plague in the United States up until around 1900 or so. And that's when there started to be trading ships from China and Hong Kong that had rats and their plague-inflected fleas on them. And those ships, you know, started trading more, and you had outbreaks of plague in some of your port cities. So there were outbreaks of plague in Honolulu, Seattle, San Francisco, Los Angeles, Galveston, and in all those places around 1900, they kind of died out. it wasn't able to sustain itself, except in the San Francisco area. So the plague was able to go from a cycle of, the rats along the shore there and their fleas, and spread into the wild animal population, the ground squirrels, the wood rats, some of the mice. And from there, around 1900, was able to spread across the western United States up to about what we call the 100th meridian, which is around, western North Dakota, western South Dakota, western Oklahoma, and western Texas. It went that far and really hasn't gone much further. So a lot of people speculate that a lot of this is probably because of the type of rodents and fleas that are in the western United States, especially a lot of the prairie dogs and things which are very susceptible to plague, and they have lots of fleas on them. You don't have prairie dog colonies in Florida, so it seems to have spread that far and not gone any further. Now the question is, why the Southwest? Why in the New Mexico, Utah, Arizona, Colorado area do we continue to see plague year after year after year? And again, we think a lot of that has to do with our type of habitat here, with the type of trees and things we have. We have lots of different kinds of rodents that have lots of different kinds of fleas that seem to be very good vectors for plague, and the rodents are quite susceptible to where it seems to be able to come back year after year after year.
Oh, fantastic. That was very interesting. You mentioned plague in animals, so you're saying that pets are at risk of this disease?
Definitely. So we see plague in cats and dogs here in New Mexico every year, and in fact, we kind of use them as a sentinel. We encourage our veterinarians in the state, if they have a sick dog or cat that they think has plague, to submit samples, blood sample or whatever, for testing to our state public health lab, our human lab, and we do the testing there on cats and dogs also, because what we find is if we have a positive cat or dog in an area, that means plague is circulating in the rodents there, and we have a higher risk for potentially having human cases also. So we use that as kind of a sentinel to help us to warn people in an area if there's plague in that area. Now, we've also had a few of our sick cats that have had plague have also been able to give that to people, especially if they're sick and a person gets bit by the cat or scratched by the cat while they're infectious. We've had that happen. And the other thing we've had happen is we've had cats and dogs that are allowed to roam and hunt. They find a sick rodent out on the ground, and there are still infected fleas on that rodent. And of course, those fleas, they make their living by taking a blood meal from the animal. So when their rodent has died, they see the cat or the dog, and they'll jump onto the cat or dog, and the cat or dog will then bring the flea back into the home. And we've had people who have been infected that way, where they allow their dog or cat to roam and hunt, and then they allow the dog or the cat to sleep in the bed with them. The fleas jump off and bite the person. And we've had people get plague that way also.
Yeah. Let me take us in a little bit of a different direction, and even if you're not familiar with this report, I'm sure you'll be able to comment on it. Last month, there was a report published in the American Journal of Tropical Medicine and Hygiene. It listed the countries with the most reported plague during the previous decade, 2000 to 2009. And the United States was ranked 11th with 57 cases. In fact, the United States recorded at least one case of human plague in each year. Now, so here we are on the same list as the Congo and Madagascar, and Vietnam has less plague than the United States. What do you make of this data, if anything?
Well, I'm familiar with the author. That's Dr. Butler, who put that article out. That's a review article, and Dr. Butler is a very famous researcher for plague and has done lots of work for decades on plague. And again, I looked at that table also, and I think you saw some places like Madagascar and the Congo and such that had thousands of cases. And of course, I think the United States ranked in there, but much lower, a very much lower percentage of cases. And again, it's our western states. We have rodent populations now where plague has established itself, and so we have a few human cases every year. Typically, in the United States, I think we average around 7, 8, or 9 cases in the whole United States per year. And again, half of those cases occur in New Mexico every year, and that's, again, the question, like I said, I think it's the diverse rodent population and the diverse flea population in New Mexico that allows it to survive and to have cases in the rodents and pets and then 1 or 2 cases per human, on average per year after year.
Right. And I'm glad you were able to explain that so clearly because, I covered the New Mexico plague cases, and when I tell people about, we have some plague in the United States, they're like, what? Really? So I'm very happy that you were able to succinctly explain what's going on out there.
Sure.
And lastly, back to your job in New Mexico, what advice do you give people, the citizens of New Mexico, on keeping safe and preventing contracting the plague?
Right. And again, I think we try to tell people, this is an extremely rare disease. I mean, compared to a lot of other things, it is quite rare. But again, when you talk about plague, that can scare people. So we really try to tell people, yes, it's a rare disease, but there are things you can do to decrease your risk. Keep your pets from roaming and hunting. Try to clean up areas near your home where rodents live, like wood piles or brush piles or abandoned vehicles. If your pet's sick, take it in promptly to your veterinarian. Use a flea control product on your pet. If you yourself develop an unexplained illness with a sudden fever, make sure you go in to see your doctor right away. Don't leave pet food out where it attracts mice and rodents near your home. Those simple things actually are quite effective in terms of really reducing your risk.
Right. All right. Well, I've been talking to Dr. Paul Ettestad, the state veterinarian with the New Mexico Health Department. And Dr. Ettestad, I appreciate you talking to me today, and it was more than informative. And thanks a lot, and have a nice weekend.
All right. Thank you very much.